Weeks 8 to 14 or Phase 2 goals include glenohumeral range of motion should be at 90 to 120 degrees, and specifically flexion and abduction. The second goal should be progress from active assisted to active range of motion. The third goal should be pain is decreased when in resting posture. Fourth, create a baseline humeral head control. And 5, begin functional activities and ADLs. Proprioception exercises can begin below the shoulder. For progression, to progress to Phase 3, the patient must have proficient resting scapular posture and proficient dynamic control of the scapula during range of motion exercises. The patient must also have pain-free active range of motion with no compensation. For example, the patient should be able to do 30 repetitions of standing flexion without compensation of the trapezius muscle, and also should be able to do 30 repetitions of external rotation side lying without weight to progress to Phase 3.
For a warm-up, the patient can perform a 10-minute walk on the treadmill at whatever speed is comfortable for them. For our patient, we're doing 3 miles per hour. And then after 10 minutes, once they feel warmed up, they can get off. The patient will be performing clamshells. For this, they're going to put a band above their knees. You're then going to instruct them to lift their knee up while keeping their hips aligned, and then returning to the original position. They're also going to do this on the opposite side, and they're going to perform 2 sets of 15 on each side. The patient will be performing glute bridges next. And so for this, they're going to be lying supine with their feet flat on the table and their knees bent. You're going to then instruct them to drive their hips up towards the ceiling. They're then going to hold that for 2 seconds and then come down to the relaxed position. They're then going to do this for 2 sets of 15. A body blade will be used to help strengthen the shoulder as well. For this, we're going to be putting the patient in 45 degrees of forward shoulder flexion, and you're then going to instruct them to shake their arm back and forth to start the movement of the body blade. They're going to do this for 15 seconds, then relax and complete another set. Another isometric exercise that the patient should be able to perform by the end of Phase 2 is going to be weighted flexion. So with this, the patient is going to start with their elbow at 90 degrees, and they're then going to be pushing up and extending their elbow into shoulder flexion. We're going to have them do this for 2 sets of 10. Next, we're going to be doing some isometric exercises. For this, the patient is first going to stand facing a door frame. You're then going to place the ball against the wall and have them push into the ball with their elbow at 90 degrees and their arm against their side. You're then going to have them hold this for 15 seconds and relax, and then have them repeat this again. Next, we can have them stand facing the wall, and then with their shoulder against their side again, pushing the ball into the wall. For the next one, we can have them then turn around and have their elbow pushing into the ball. And then for the last one, we can have them turn, so they're facing me, and then pushing the side of their arm into the ball. By this point, the patient should be able to perform active range of motion against gravity. So to work on external rotation, we're going to place a rolled towel under their arm while they're side lying, and then you're going to instruct them to move their arm into external rotation as far as they can go, and then back to neutral. You're going to repeat this for 2 sets of 15. Next, the patient will be performing stability ball ABCs. For this, you're going to put them standing close to the ball. You're then going to have them go into a slightly knee bent position. You're then going to have them hinge at the waist, and put their hand on the ball. You're then going to tell them to roll the ball to form the letters of the ABCs. Next, we will be doing wall slides. For this, you're going to have the patient put the ball against the wall and then put their hand in the center of the ball. You're then going to instruct them to push the ball up and step into it so they can get increased range of motion. You're then going to have them back down, and then you're going to have them repeat this for 2 sets of 10. This is working on flexion range of motion. You're also going to want to work on scaption, so you're going to have them take a couple steps to the side, and then again, roll the ball up and move into the motion. Good. Next, we're going to be using the stability ball for a proprioceptive exercise. For this, you're going to put the ball against the wall, and then you're going to have the patient in 45 degrees of shoulder flexion, holding the ball against the wall. The clinician is then going to lightly tap the ball in random spots so the patient can stabilize it against the wall. You're going to do this for a minute, take a break, and then repeat it again. Next, we will be doing prone arm raises at 0 degrees. For this, the patient's going to be lying on their stomach with their arm by their side and their palm facing the ceiling. Next, you're going to instruct them to actively lift up their arm. Hold it for 2 seconds and then relax. You're going to ask them to perform this for 2 sets of 10. Next, the patient will be performing towel slides on the table. For this, you can have them pretend that there is a clock on the table and you can ask them to go to different numbers. For example, we can have them go to 12 o'clock, so they're going to move their arms straight up. Then we can ask them to go to 6 o'clock and they'll move their arms straight back. We can then say 9 o'clock, 3 o'clock, 6 o'clock. Good. Next, we will be doing resisted scapular movements. For this, you're going to ask the patient to go into elevation and you're going to apply a downward resistance. Go ahead. You can then ask them to go back down and then bring their shoulders to the back and then bring their shoulders forward. You can do all of these motions for 2 sets of 10. Next, we will be doing joint mobs at the shoulder. For this, you're going to have the patient scoot towards you so their arm is off of the table. You're then going to support their arm, and you're then going to distract the shoulder and quickly move it up and down. You're going to do this for 30 seconds, relax, and then repeat again. Next, we'll be doing a scar tissue massage. This can help so there won't be as much of a scar once it is completely healed. For this, you're going to use massage cream, and then you're going to do a friction massage over the incision sites. And you're going to do this for all of them, and you're going to perform this massage on each spot for about 2 minutes. Finally, we're going to finish our treatment off with ice and e-stim. So for this, you're going to place a pad on either side of where they're having their pain. You're then going to place an ice bag on top and begin to turn the machine up, and then instructing them to let you know when they start to feel it.
I feel it.
All right, now let me know when it's strong but comfortable.
Right there's pretty good.
All right, you're then going to start the treatment, and it's going to continue for 15 minutes.
And release all of those sounds that are trapped in your mind. Sir, are you okay?
I'm a little messed up.